Did you know that the secret to a smoother pregnancy and postpartum recovery journey might just lie in your glutes? And no, I'm not talking about aesthetics here. I'll leave that to the Fitspo crew. What I'm talking about is a critical yet often overlooked aspect of women's health: the deep connection between your glutes and the pelvic floor, and why understanding this relationship is vital, especially during pregnancy and your postpartum recovery journey. So if you're trying to conceive, currently pregnant, or in your postnatal recovery journey, then listen up, because this video is absolutely for you. And to really grasp this deep connection, let's start with anatomy. And I'm going to keep this quite high level here, because there are 9 main muscles that make up the pelvic floor and 4 primary muscles that make up the glute complex. So I'm not going to get too deep in the weeds with the anatomy here. But the muscles of the pelvic floor form a muscular sheet or diaphragm that spans from the pubic bone to the coccyx and between the ischial tuberosities on either side. The levator ani is the largest and most important muscle group of your pelvic floor. And these muscles play a critical role in supporting your pelvic organs, maintaining urinary and fecal continence, and facilitating functions like going to the bathroom and sexual function, which is of course very important. And weakness or dysfunction of the pelvic floor can lead to conditions like pelvic organ prolapse and incontinence. But when it comes to your glutes, the gluteus maximus, or glute max, is the largest and most powerful muscle in your body. And it attaches to the posterior side of the pelvis and plays a critical role in stabilizing your pelvis and supporting your lower back. And the anatomical position of the glute max allows it to influence the pelvic floor's function, but particularly during dynamic movements like walking and running, right? And research has shown that the glute max, along with the gluteus medius or glute med, is integral in maintaining pelvic alignment and stability, which is essential for your pelvic floor's health. Now, if we dig a little deeper into this synergistic relationship, you'll find many connections from fascial to neural, which have significant functional implications. And a 2023 study found that the glute max muscle is linked to the pelvic floor via strands of connective tissue, suggesting that under certain conditions, the glute max may influence the pelvic floor's function and potentially contribute to urinary incontinence. But the good news is this same connection may also offer a protective effect on continence as well. Now, there's also a neurological link between your glutes and your pelvic floor, with one study showing that the brain regions controlling the glute max and pelvic floor are interconnected. And this means that voluntary activation of your glutes can involuntarily activate your pelvic floor muscles, highlighting how much of a positive link there is between strengthening your glutes and pelvic floor stability and health. And these are just 2 of the many studies that highlight the interdependence of these 2 muscle groups, or of these muscle groups. But when it comes to pregnancy, your body goes through significant changes, from hormonal fluctuations, weight gain, and your growing baby, which together alter posture, muscle function, and overall biomechanics. And of course, all of this impacts your glutes and pelvic floor. So as your pregnancy progresses, your growing baby shifts your center of gravity forward, causing your pelvis to tilt anteriorly, altering your lumbar spine. And of course, these changes can place strain on your glutes, causing them to work harder to stabilize your pelvis, potentially leading to muscle fatigue and weakness. On top of this, the increase in a hormone called relaxin causes the ligaments in the pelvic area to loosen in preparation for birth. And this can lead to joint instability, especially in the pelvic girdle, affecting the recruitment of stabilizing muscles like the glute max and glute med. Now, over time, due to the fatigue and weakness I just mentioned, these muscles can become less effective at stabilizing the pelvis, leading to pelvic girdle pain and lower back pain. And these changes in posture and weight distribution can also affect neuromuscular control. Then you have the lengthening of abdominal muscles and the separation of the linea alba, which can impact your core's ability to stabilize the pelvis effectively. So if your core isn't working correctly, your body's going to recruit other muscles to help. And you know who they're going to be calling on? Your glutes. So over time, these altered activation patterns can further weaken your glute complex. So when it comes to pregnancy, you can kind of see how the increased weight of your baby adds pressure to the pelvic floor, alongside potential weakening of the glutes, which play a critical role in supporting the pelvic floor and maintaining its function. So if you aren't strengthening them correctly, this can lead to high risk of pelvic floor dysfunction, including urinary incontinence and pelvic organ prolapse. And this, of course, all carries over to your postpartum recovery journey, which is why all of this is so important. It's not just about aesthetics. Of course, that's a great byproduct, but for the ongoing health of your pelvic floor, maintaining strength in your glutes is vital during pregnancy. In fact, starting to strengthen your glute complex prior to falling pregnant would probably be ideal, as you won't have that pesky anterior pelvic tilt getting in the way of achieving full posterior pelvic tilt. And of course, my 4 top exercises for maintaining glute strength during pregnancy are a banded 3-way hip thrust, a single leg 90-degree leg press, a banded kettlebell deadlift, and an incline bench side-lying hip abduction. But remember, proper form is crucial. Always focus on breathing correctly and maintaining neutral intra-abdominal pressure. You shouldn't be able to see any bulging or doming or peaking of your abdomen during these exercises. And of course, if you're not sure what I mean or how to do this, my advice to you would be to seek the help of a professional coach, or feel free to reach out to me. So there you have it. The reason why training your glutes during pregnancy goes far deeper than surface level, and could actually be the secret to a smoother pregnancy and postpartum recovery journey. But the key takeaways I want you to remember are your pelvic floor and glutes are deeply interconnected, with the glute max playing a crucial role in stabilizing your pelvis and supporting your pelvic floor. And that research shows fascial and neurological connections between the glutes and your pelvic floor, indicating that strengthening your glutes can positively impact your pelvic floor function. And that maintaining glute strength throughout your pregnancy can help prevent pelvic floor dysfunction and promote a smoother postpartum recovery journey. So by prioritizing glute strength during pregnancy, you're actually investing in the long-term health of your pelvic floor and setting yourself up for a more comfortable pregnancy and postpartum recovery journey. And I really hope this video helps you make more informed decisions about training during pregnancy. I'd love to hear your thoughts on this, so feel free to drop me a comment below. And of course, if you want more in-depth pregnancy-specific content, feel free to apply to my complimentary but private community, the Preggy Training Crew. The link is in my bio.